their red flag symptoms which have been discussed. And secondly, to decide on immediate first line management system. What are you going to do the moment you receive patient with ocular emergencies? Okay. Right. And then you have to understand the referral urgency and the care pathways. Who are you going to refer? Does you have to refer to OFTAL for all your patients? Okay, does you have to basically send your patient to A&E first? Okay, that you need to understand well on the urgent ocular matters. Okay, on the urgent ocular care matters. Because why? First, vision can be lost in minutes. Okay, vision can be lost in minutes. Example, in chemical burns or central retinal artery occlusion. Okay, so example, a real life case, a 25-year-old with chemicals splashed. Okay, so they delayed the washing or irrigating the eye. It leads to a permanent scarring. Okay, if it's not at the center of the cornea, maybe the vision can be saved. If it's on the center, then that's it lah. Okay, the patient will lose their vision. Okay, so key stats. Okay, what is that? Something to start immediate. Okay, the key stats. So 10% of emergency visits with eye trauma risk long-term visual impairment. Okay, so any emergency visit from patients that you have received, okay, you have to check thoroughly, okay, because some of the cases will risk a long-term visual impairment. Okay. Okay, this is an example of severe chemical injury with early corneal neovascularization. Okay, what can you see here? What are the signs that you can see?
Corneal opacity.
Oh, corneal opacity, yes.
Hemorrhage.
Yes. Hemorrhage, yes.
Neovascularization.
Sorry.
Neovascularization.
Neovascularization, severe one lah. This one is
Mm.
already I think a stage or grade 4 already. Okay, and you can see an ulcer at the center, the whitish part here.
Yes.
Yes.
Corneal
So,
edema as well.
yes, corneal edema, correct. Basically, we can't see the color of the iris at the back.
Opacity already.
Yes, opacity
Corneal
already.
opacity.
There's an ulcer at the center,
Mucus.
so this ulcer will lead to a permanent scarring. And you can see a mucus. Okay, at the side here, there is already a mucus. Okay, so a mucus, this mucus may be by the management of the clinicians lah. Maybe they put some gels, okay, to reduce the symptoms, right? So, one scenario that I would like to share, a chemical burn, okay, a factory worker splashes alkali in his right eye. Okay, so the worker or the patient complains of severe pain, blurred vision, and redness. Okay, so what's the first step that you need to do? And
Bring
then
eyes.
sorry,
Sorry.
you can share. It's okay.
It's okay. You go. You talk first.
Okay, so what's the first step that you need to do? Okay, this actually I need you to do a group activity. Okay.
Oh, okay.
Yeah, so you take note first. Okay, so later on, I'm going to split you into 2 groups, 2 or 3 groups, let's see. And then you have to come out with discussion points lah. And then secondly, what not to do and when do you need to refer to ophthalmology. Okay, so this is the first case 1, chemical burn. Right? Okay, case 2, ignore the slide 4, it's a typo. Case 2, sudden painless vision lost. Okay. I think you can screenshot or you can take photo. Okay. So that you, once I separated you in a room, then you have your referral, I mean the things that you need to do. Okay, a 60-year-old man presents with sudden vision loss in one eye, no pain, and the fundus exam shows a cherry red spot. Okay, so this is cherry red spot. Okay, this one, I already gave the answer. Okay, this one no need to discuss lah. Just the first one, the chemical burns. So the likely diagnosis is CRAO. Immediate actions that you can do for this case is ocular massage and then urgent ophthalmology referral. How urgent? As soon as possible. And then the time of irreversible damage is less than 4 hours. If you refer patient less than 4 hours, then the condition can be reversible. If more than 4 hours, then it can lead to a permanent symptoms. Okay. So basically for chemical injuries, irrigation is king. Okay. For any painless sudden vision loss, you need to refer to emergency. Okay. And then if there is any globe rupture or penetrating injuries, don't delay, straight away send to emergency as well. Okay, just a quick question, quick quiz question. What is the correct first response for chemical burns? The answer is already at the top. So the answer is irrigation with saline or water. So make sure to keep enough saline in your practice just in case you have any walk-in ocular emergency. Okay, so this is the patient's experience a severe alkali chemical injury resulting in corneal opacification, pannus. Okay, I think somebody mentioned pannus just now, and symbol farron formation. Okay, so these photos were taken 6 months after the injury. So you can see that basically the eye is gone lah, right? Okay, so second activity that you need to do is, okay, show 5 to 6 images of ocular emergencies related to chemical burn, hyphema, retinal detachment, and globe rupture. Okay, and then you have to identify the condition and state the first line action. This is to enhance quick visual recognitions of emergencies. So in the group later on, you do a research, find images for this 1, 2, 3, 4 ocular emergencies. And what will be the first action for us as optometrists? Okay. And then next, if you refer to a physician, what physicians? Ophthalm, GP, medical department. Okay. Then what is basically they gonna do to the patient first? Okay. That is important because patient gonna ask you, if you send them to hospital, basically what are they going to go through? So you need to have that knowledge, right? Okay. Third activity, you have to provide five short case vignettes, okay? 5 short cases, presentations on sudden painless vision loss, corneal abrasion, subconjunctival hemorrhage. So 1, 2, 3. 3 topics with 5 short cases. So one condition can be 2 cases of vignettes, okay? So groups, this one by group. So you have to mention on the urgency, whether it's immediate, on the same day, or just a routine follow-up. Okay, this is to learn on prioritization and triage decision. Okay. Right. And then last activity, okay, outline the management plan for a 45-year-old with sudden vision loss and headache. Okay, so you have to outline management, only management for a 45-year-old with sudden vision loss and headache. Okay, so how many activities already? 1, 2, 3, and 4. No, this one, 4. Okay, So these 4 activities, you're going to put in a PowerPoint. Okay, I give you time, half an hour. Okay, half an hour only. Yeah, I don't want to make it so elaborative and lengthy. Make it short, simple, and concise. Discuss with your group member. Okay, make sure everyone got their roles, what and what to do. Okay, so I'm going to divide you guys into 2 groups. So we're going to have 2 presentations.
Miss Edie, can you go to the second slide? Just now, the
Second
case one,
slide.
second slide. Yeah, number
This one?
7. No, slide 7.
Slide 7. Okay. This one?
Okay. So this one we're gonna to do.
Or else, right? I'm just going to show. I'm going to just going to share with this one for you to see. Okay, easy.
Yeah.
Okay.
I'm going to share later. Okay, so now I'm going to break you into 2 rooms. Huh? Okay, it's random, random people in each room.